Well, Florence is this wonderful thing that I text every day. It's just the most amazing innovation.
Florence, or Flo, as she is affectionately named, is a text messaging system designed by the NHS to help people manage their healthcare. The Western Isles is a small group of islands, approximately 50 miles off the northwest coast of Scotland. Access to services and facilities in the Western Isles is not the same as living in a large town or city environment. We often have to fly clinicians onto the island. We often have to fly patients off the island. This can be very distressing for patients, it can be very time consuming, and is obviously very inefficient when it comes to producing a modern healthcare service. A large proportion of our island population is elderly. This means that it can become difficult to move around the island. It can be difficult to attend hospital and clinic appointments. Therefore, many of our community nurses and specialist nurses will visit patients in their own home to carry out assessments and consultations. Travelling to patients' homes can be very challenging. Inclement weather, especially during the winter months, can prevent travel altogether or can add an element of danger to that travel. 100-mile-an-hour winds are not uncommon for us during the winter, and they even put in the odd surprise appearance during the summer.
Flow's different because it's actually really simple to use, not just for the patients but for the staff, and I think that matters. I think certainly these days people of all ages are quite used to dealing with the mobile phones and text messages, so it's not intrusive technology in the house. We've not had to install anything special. There's been no disruption to patients in setting it up. A text is sent to patients at a certain time, at a predetermined time in the morning, asking them to text their weight. If the weight is within the parameters that we've set, Florence will just say thank you. If it's out with those parameters, another protocol is triggered which asks some supplementary questions. We've discussed those questions with the patient previously so they know what to expect. They are all in possession of a traffic lights leaflet, so it's essentially repeating the questions. If the answer to any of those is yes, then that triggers another protocol which tells them that they must contact their heart failure nurse or their GP.
Much to my surprise and horror, I found I had developed cardiomyopathy and failure. I've been treated by the heart failure team locally and by the consultant in Glasgow, and I'm really well. My friend Florence, or Bossy Flossie as I call her, has had a huge part to play in that in lots of ways. In order to manage the heart failure, I have to manage my fluid balance and I have to manage my blood pressure. Every morning I actually get 3 texts. That's why I call her Bossy Flossie. I get a text at about 8 o'clock reminding me to send in my weight for the day. And another one reminding me to send in my blood pressure for the day, and then about an hour and a half later I get a text to remind me that I haven't done it yet. I know that every day I'm going to send in my weight and my blood pressure, and I also know that every day this information gets downloaded if there's an abnormality of any kind, or if there's any concern that I've gained a little more weight than I ought to have done in 24 hours, or that my blood pressure is not performing as they would expect. I know that the clinicians will be able to pick that up.
Have a patient who asked us to set up Flo to remind her before she went to bed at night, had she taken the tablets, and she can say yes, so she doesn't wake up in the night worrying about it. Actually, she can just look at her phone, see that she's texted back yes. We use it to send out reminders to come to clinics, or if clinics are cancelled. In cardiac rehabilitation, we found it really useful, particularly in monitoring blood pressure. If somebody comes to our class and their blood pressure's a bit high, we can quickly set them up on Flo. A more recent innovation, actually, particularly since we've had a new drug that's just come out in heart failure that we've been fairly cautious with and can cause drops in blood pressure. We've been using it to monitor and titrate patients. We've had benefits as well around weight management. This is actually patients who for years have struggled to lose weight, who found that over and above writing their weight down every day, which they were doing anyway, just somehow the act of texting it to Florence has really helped them to get control of their actual weight. There are times when we don't have to either visit a patient or bring them into clinic. Before I see a patient at a home visit or in clinic, I will have a look at their data, I can print it off and take it into clinic and we can share that data. We have patients who say, please don't take this away from me. A 90-year-old gentleman said that to me recently, who's managing the texting, and he's certainly an example of somebody that I've been seeing less in clinic, because sometimes he doesn't need to travel in a fairly long distance, it's a remote area. Other quotes from people who found that they've really come to depend on Flo are, she's a nagging old what's it, but I depend on her and she's very important to me.
It's completely reassuring and it gives me control. On the plus side of all this, there's not a whole lot of plus sides to having heart failure, but one of the things is that I lost a lot of weight. I had gained some. I was too heavy anyway. I'd lost a lot of weight, and Flossie is a perfect way of maintaining your smaller dress size. Well, I expect Florence to be part of my life as long as I live. I'm never going to give her up, however much she nags me.